This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
A first thing to understand or apply is to think about how measuring performance both within and across your health system and identify where those aspects of variation are, and then think about what's the decision-making design and structure within your organization and how could that be impacting areas where you're seeing variation or less efficiencies across the health system.
Welcome to SG2 Perspectives. I'm your host for today, Jayme Zage. I am joined today by three colleagues from the Vizient Research Institute, Erika Johnson, Victoria Beal, and Vern Herbener. Today, we're going to talk about organizational design and decision-making. I really wanted to bring this episode to you. We get so many questions on org structure and how org design impacts strategy and the ability to execute on strategy. The work that Erika, Victoria, and Vern have done is really focused on performance and how structure and organizational design drives performance. And so I'm excited to bring this research to you today. Erika, lead us off. What were you hoping to understand as we engaged organizations on how they make decisions?
Thanks so much, Jayme, for having us. We're really excited to be here to share insights from the Vizient Research Institute. We came to focus on the topic of our research study this year, given the pervasiveness around consolidation in the healthcare industry. For those of us that have been in the industry for 20, 25 years, consolidation has been occurring over and over again. We within the Research Institute have really been asking the question over the last several years, why form a health system? Why bring together multiple hospitals into a system? And for that matter, today, why bring together multiple hospital health systems to make an even bigger multi-hospital health system? What is really the value in forming a system? We've conducted over the past several years a number of studies looking at testing that value proposition as health systems. Our research, as well as other research, question the value of health system formation more in terms of care delivery. We've studied a number of utilization metrics to show that there's wide variation in care that's going on amongst our health systems, meaning that if a patient was to present at one of the hospitals within our health systems, we have demonstrated that they could likely be getting very different care than if that same hospital with the same diagnosis walked into another hospital of the health system. Given that variation in care, we were really interested in focusing a little bit more specifically this year around why that is occurring and trying to better understand from an organizational design and governance perspective how that might be influencing care delivery. In terms of mergers and acquisitions, there are a number of organizational structure. There's not a one-size-fits-all model in terms of what is the optimal structure of a health system to deliver optimal performance. So we were interested, as we set out on the study, to look more specifically at the organizational structure and the governance models specifically amongst multi-hospital health systems and to test or ask the question, does the different structures actually influence or impact performance? The way that we went about our study this year to really understand governance structures and organizational models was to design a survey to distribute to our client organizations. We developed a survey and distributed it to the C-suite leaders amongst both Vizient and SG2 clients to ask questions and to better understand organizational structures and the decision rights within their organizations. Rather than developing a generic survey, we actually designed what we like to think are real world or real life scenarios that our health systems are facing on a routine basis and to ask more specific questions around those scenarios. The scenarios within the survey involved things like operational efficiency, focusing on clinical variation, program consolidation, and workforce decisions were the topics that we ended up focusing on to better understand the decision-making processes.
Thanks for the overview and the why behind the study, Erika. Victoria, start us off with some of the most surprising findings in the study.
Thanks, Jayme. A couple of things that were surprising to us. First, we originally were hypothesizing or expecting to see that these health systems fell within a handful of archetypes or organizational decision-making structures, but that was not what we found. We found that health systems varied in the ways that they made decisions, both across health systems and then within the same health system. Overall, we found that most health systems leaned more towards a centralized decision-making structure, with decision-making centralized at the system level. But then the level of involvement in who the stakeholders were in making those decisions also tended more towards hierarchical versus more of a consensus-driven decision-making style. And then what was really interesting is that within health systems, we found that health systems are making decisions in different ways across the 4 scenarios that we were surveying. While most systems were centralized, we found that the scenario with the most centralization was the clinical variation scenario, where 80% of the survey respondents were saying that they were highly centralized or more centralized in the way that they made those decisions. On the flip side, workforce and the program consolidation scenarios tended to be less centralized, with only 60% of survey respondents saying that they were centralized. As far as the level of involvement of stakeholders, 75% of respondents said that their system made decisions in a more hierarchical fashion. Another thing that was interesting was that we saw a lack of alignment between respondents who had different roles. For example, in the operation efficiency scenario, 47% of COOs who responded to the survey said that they felt decisions were made centrally within their system, and that's compared to 77% of CEOs who were saying they thought those decisions were made centrally. So we see that lack of alignment. And we saw something similar along the program consolidation scenario, where 70% of CEOs were saying that they thought that their system made those program consolidations decisions centrally, but 50% or so of CFOs and 60% of clinical leaders were saying that they were more centralized on those decisions.
As we've started to share this work with member audiences, they're surprised by these differences in the perceptions of how the decision-making processes are occurring. I was recently at a CEO meeting, and the CEOs were looking at the data and the findings and saying, how can this be? I don't understand why there are different perceptions within the organization. That was surprising to us as we've gone out and now shared that they're just as surprised by seeing this. It's created a question in their mind of wanting to go back and addressing this and making sure that there's clarity in the meetings that are occurring and the decisions that are being made in terms of how they're going to move forward as a system around us. That was surprising as we started to share this with certain audiences.
I understand that a lot of the performance side of this was based on quality measures. Vern talked to us about which of those quality measures were most impacted by either hierarchical or centralized decision-making.
Sure. Thanks, Jayme. We looked at a variety of performance measures, and we used hospital data in the Vizient clinical database and other sources of data that our members provide. As many of your listeners may know, Vizient conducts a rigorous assessment of hospital quality each year called the Vizient Quality and Accountability Study. Our team utilized last year's hospital level results from that study, and we calculated percentile scores at the system level. For safety and mortality, which represent the 2 largest components of the overall quality rankings, we found that systems that reported making more centralized decisions related to clinical variation and workforce were more likely to score higher than decentralized systems.
When we were measuring performance with decision-making involvement, whether a system is making decisions more hierarchically versus consensus, we found systems that are making decisions in a more hierarchical design were much more likely to have higher Q&A percentile rankings for their patient safety compared to those who reported that they made decisions in a more consensus-based manner.
We've talked about the study design, surprising findings. We've talked about some of the measures that were most impacted by the type of decision making. I want to focus now on some of the lessons and what our audience can do as they think about their own organization. From the study, what do we want our audience to understand as they look at decision making at their own organization?
A first thing to understand or maybe apply is to think about how measuring performance both within and across your health system and identify where those aspects of variation are, and then think about what's the decision-making design and structure within your organization and how could that be impacting areas where you're seeing variation or less efficiencies across the health system.
I would maybe just reemphasize, as part of the methodology that Vern described, we went to look at the Q&A ranking at a system level as opposed to an individual hospital level, and encouraging our members to start to look at system performance as opposed to individual hospital performance is one of the key lessons in understanding the difference in performance. And then how do you take that back to really understanding how is our organizational structure and how is the decision-making processes within our organizations influencing the system performance, not necessarily the individual hospital performance only.
It's fair for us to think that patients should be able to have a reasonable expectation that no matter what hospital they go to within a given health system, they should be getting similar care. Right now, the data provides a lot of examples where that's not happening, and we should consider how our decision-making may be influencing that and look for opportunities to improve.
One of the findings from the survey was actually that either a quarter or a third of systems who said that they had centralized consistent decision making also said that they felt that their staff and their patient experience across their system was not a consistent experience, that patients and staff were actually experiencing inconsistent care or inconsistent experiences. Health systems are perceiving that there's differences, and so it's important to be able to measure where those differences are, why they're occurring, and then take those steps to address that.
One of the other key takeaways from this body of work, wanting to focus on organizational design, that tends to take precedence in terms of the actual structure, the focus on designing the structure for the organization when two organizations or two multi-hospital health systems come together, that the priority has tended to be focused on what structure, what organizational chart do we need to have, where does everybody need to sit in the boxes on our organizational chart, rather than first focusing on, as this new health system entity, what is our vision for the future? How do we want to be as this new, bigger, better entity in the future? Setting that strategy, then determining what the decision-making processes need to be able to achieve that vision and strategy. And then from there, what is the organizational design or structure that we need to be successful in achieving that strategy? Today, oftentimes, my perception is that when we're going through this merger and acquisition and organizational design process, we focus on the design aspect first without asking the question, where we want to head as a system, and then letting the structure be designed based on that future vision for optimal performance.
I completely agree, Erika, and I think that's a great way to end our episode, to think about where does organizational design fit in building your organization to meet that vision. Strategy first, then think about how you're going to achieve that strategy, and then build the tool, the structure to meet it. Thank you so much, Vern, Victoria, Erika, for sharing with our clients today. Appreciate all of our listeners at SG2 Perspectives, and until next time, thank you.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.